Give a couple seconds. Hello, 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 everyone. Hello. Um, while I'm waiting to see if people see the live, I wanted to introduce myself. I am Ashley. I am the founder of Cannabis Nursing Solutions. I am I guess, the nucleus of the Highline tribe. Although I would like to say that the tribe itself, it's its own energetic force. But I wanted to come on today and talk to you all about the role of the nurse in cannabis. So there are some common questions that I get regularly. Hold on. Let me back up some and say this. I want to start doing these lives weekly. Let me know if you all are interested in time differences or specific topics, or if you have specific questions. And so today I'm going to talk about the role of the nurse because I know that's something that comes up often in my inboxes and even in conversation when people first join the tribe. And so recently I hosted a conversation from the bedside or beyond the bedside to becoming a holistic healer, where we broke down the process from moving from the bedside to identifying yourself as a healer. And as many of you know, as a nurse or healthcare professional, you are a healer. But you don't have to be a nurse or healthcare professional to be a healer. And so there are people who do that. And so it's really important to understand the role of the nurse in the cannabis industry. So that way you don't walk into it with a fear-based perspective, which is what I'm trying to avoid for many of you, even if you don't decide to join the tribe or anything along those lines. So I do have notes here. So let me pull them up. We're going to talk about the scope of practice for the nurse in the cannabis space. Hold on. We're going to talk about our roles and responsibilities as defined by the National Council for State Boards of Nursing. What's interesting is that a lot of people don't realize this, but we do have our scope of practice and our roles and responsibilities defined for us. And so the biggest question that most people ask me is, what about my license? What happens if I were to dive into this area and somebody wanted to take my license away? And the scope of practice defines where we can exert our skills and our expertise in our practice. And the guidelines are also defined for us for the National Council for State Boards of Nursing, which means your state board of nursing has these rules that govern it. Now, does everybody accept the scope of practice in our guidelines? No, they don't. But it is our responsibility to advocate for ourselves and to advocate for our patients the way that the way it has been defined to do so. So, as far as the scope of practice is concerned, the American Cannabis Nurses Association has created resources to help define how we interact with cannabis in our patients. And many of those, the scope, and I'm not going to go through the entire thing, but much of the scope are things that we're familiar with, right? So talking about assessment, talking about professionalism, talking about ethical considerations. And a lot of people don't realize this, but when dealing with clients, we still need to do a full assessment, and it needs to be inclusive of holistic options. You might have seen the post somewhere where I said holistic options is inclusive of cannabis if that's a choice that your patient makes. And so, what type of questions, interviews type questions, are you asking your patient in order to determine what, why, and how they're choosing to consume? Because a patient who consumes cannabis from a dispensary versus a patient who consumes cannabis from the legacy market, that's a different conversation. Some of the conversation, and it doesn't mean that one is better than the other because of the legal status of our of cannabis as a whole. But most likely the person who buys from the legal market has a little bit less information about the plant and the product that they are consuming. Most likely it hasn't been tested, whereas when you go to the dispensary, it probably has been tested and they might have some more information on hand, meaning they have the profile, the cannabinoid profile, meaning they may know the terpene profile, meaning they may know if it has been laced with pesticides, things along those lines. And so that is part of the assessment process. Identifying the method of consumption matters. Methods of consumption uh, play a part in onset and duration time. And so, again, that goes into the assessment. And so, our scope of practice actually walks through the various ways that we need to interact with our patient for therapeutic use of cannabis and advocating for safe practice. The other scope that I want to highlight in this conversation is around ethical considerations. So, one of the biggest issues in this space is the stigma. I talk a ton about stigma in different ways. For me, a lot of the conversation around stigma is around stigma around the nurse specifically. A lot of us have been stigmatized and don't even realize it. But the stigma also plays a part in the way that we interact with the patients. So some of us may have fear and judgment because of the way that we have been pre-programmed due to the war on drugs, due to, all the ways that it has been demonized in our modern society through the media, through PSAs, things along those lines. And so what that means is that if we are fearful or if we have judgment of the plant, when we're interacting with the client who chooses the plant for their medicine, most likely we are not passing that bias on to the patient. So, what does that look like? It looks like that maybe we are shutting down the conversation, but prematurely, right? Maybe we're not asking all the questions that need to be asked in order to make sure we are making the best medical decisions for our patients, right? And so, those are ethical issues that pop up because as healthcare providers, we provide care to all patients, not just the ones that choose the methods of achieving wellness that we decide. And so another question that comes up for me, to me, often is, what is my personal cannabis consumption? That's not important when I'm interacting with a patient or when I'm teaching about cannabis, right? Like that's not a conversation that needs to be had. And it really just doesn't matter in relation to how I am assessing my patient, how I am discerning what implementation methods we need to consider, or how I'm going to evaluate my patient when they have implemented the plan that we have put together. And so it's important that we recognize our role and responsibility, regardless of the personal consumption choices that we make. And this applies even if you do choose to consume, because your relationship with the plant, if you are a consumer, is going to look different than that of your patient or your client. We still need to interact professionally when we're dealing with it. So let's say, for example, I'm suffering from diabetes. I have my own care methods in dealing with my diabetic situation, whether I am injecting insulin, whether I have to take a hypoglycemic. That is my personal health and wellness. I'm not going to approach my patient with information about what I have to do for me because that may not apply for my patient. It's a completely different disease process for that patient because they may have other underlying issues, they may have different environmental situations. So we have to be careful not to project what our relationship is with the plant onto the patient, similar to if you don't consume, not to project my bias onto the patient, and observing the patient situation, assessing that situation, and developing a plan of care that directly applies to that patient is the ideal situation, which is why we need to start shifting healthcare perspectives. We need to start shifting the way that we look at patient care, because at the end of the day, our patients are choosing options that we may or may not be privy to, may or may not know enough about. And we need to make sure that we're including some of these holistic options into our knowledge bank. So that way, when we're dealing with our patients, we can at least be aware. And so the other thing that I wanted to talk to you all about is the National Council for State Boards of Nursing. There are some principles that are included in those guidelines. And I think a lot of us are unaware of those guidelines. And so just so you all know, National Council for State Boards of Nursing oversee your state board of nursing. So regardless of your state, these guidelines apply to your state board of nursing, regardless of the legal status. So if you're in Texas, if you're in Florida, if you're in West Virginia, those guidelines still apply, right? And so they may not act on them, they may not acknowledge them, but they're there to protect really the entity called the State Board of Nursing, but also it gives you guidance in how you can function in your role as a nurse or healthcare provider. I also want to say this too, because it comes up often, is that LPNs, anybody actually, anybody regardless of your licensure, can interact in this space. You can offer care to patients. So the thing that makes nursing unique, regardless if you're LPN or RN, MP, one thing that makes us unique is that we have a very specific skill set based on our experiences. And so if I'm a peds nurse practitioner, I have very specific pediatric experience that may apply to pediatric cannabis patients, right? If I am a med surg nurse, if I'm an ICU nurse, if I am a acute rehab, LPN, whatever, you have a skill set, and the thing that sets you apart from anybody else that operates in this space. I think that the differentiating factor is our knowledge of pathophysiology and the experience that we have in the traditional healthcare model. And so, what we're able to do specifically is integrate traditional healthcare with holistic health or in wellness in order to create what we call a unique selling proposition for the clients that we are intended to serve. All right. So, the other thing that I want to talk to you about, or I want to break down, just tell you what the guidelines are. And so, one of the guidelines is to have knowledge of your current state legalization and medical and recreational cannabis use. So, you have to know what the status is in your state. So, if in my state, I'm in Maryland, we have had a medical program since 2018. We are transitioning into a recreational model in July of this year. And so keeping up with the legal status of the plant, legal nuance of the program, because it shifts from state to state, is important. Even if you don't have necessarily a cannabis program, we have to recognize, and this comes up often too, you have to recognize that cannabis, there's always a illegal market. And there are people who operate in this market today that advocate for this plant heavily, regardless if you see it in mainstream or not. And so, one of the things that I advise people to do is to get to know what the market looks like, regardless of if it's the legacy market that you're researching, or if you're getting to know the medical program, or if you're getting to know your recreational program. At the end of the day, people are choosing it, cannabis that is, they are choosing to consume it. Where they're getting it from is what the difference is. And the amount of access is, what also makes a difference. So the other thing that you should know is to have a general understanding of the endocannabinoid system, cannabinoid receptors, cannabinoids, and the interactions between them. The endocannabinoid system is the largest neuroreceptor system in the body. The cannabinoids that we're referring to is THC, CBD, plus 100 others. A lot of people don't know this, but our body makes its own natural cannabinoids that bind to the endocannabinoid system. And so you're already halfway there if you're listening to this, because that's the premise of the interactions between the cannabinoids and the endocannabinoid system, right? And so a lot of people like to differentiate CBD and THC as if they're two separate things. I mean, they're two separate genetic components of the plant, but they all come from the same plant. There are others that are THCV, CBDA, THCA. There are a ton of over 100 other cannabinoids in the plant. But knowing that you make your own natural cannabinoids, and really what we're doing here is helping people to find homeostasis through the endocannabinoid system as healthcare providers should be the priority, or not the priority necessarily, but should be included in the care that we offer. You should also have an understanding of pharmacology. So one thing that doesn't a lot of people cannot speak to, that nurses do have the ability, and even physicians, is the interaction of the cannabinoids with other medications. The reason why assessment is so important, understanding past medical history, understanding the medications that they're taking, mechanism of action, that all plays a part in how the cannabinoids are able to bind to receptors. The other thing that's not frequently talked about, that I don't see at least, is that some of those cannabinoids can bind to receptors that other pharmaceuticals can bind to. So I can't think of the receptor right now, but SSRIs bind to a very specific receptor, and so does CBD. And so that also plays a part in the effect that it has. But it also means that some of the pharmaceuticals may not be binding appropriately. And so we have to consider weaning down medications, pharmaceuticals, or removing cannabinoids altogether. So that way you can get the most out of your medication without intoxication. If you all have questions, go ahead and put it in the chat, and I'll try and go back and look at what questions you all have. The other thing that I wanted to, the other guideline that I wanted to talk about is being able to identify safety considerations and risk. So a lot of people think that because I talk about cannabis, that I am pro cannabis in every situation. I am not. Not every patient needs to consume cannabis as the option for them, which is, again, is why assessment, experience, getting to know the plant, understanding mechanism action, all plays a part in whether or not that's a good fit for them. And so we need to be mindful as providers, healers, of just general safety. Another thing that comes up for cannabis specifically is storage. So making sure that people who shouldn't have access to cannabis don't have access to cannabis, the same way that you would make sure that the person who doesn't need to have access to opioids shouldn't have access to opioids. So keeping it high, locked. But the other thing that's specific to cannabis, because it is a natural plant, is keeping it stored in a place that's not too humid. So that way it doesn't decarboxylize, change the composition of a plant. So if you buy plant A, which is a specific strain, and you're looking at it for cannabinoid profiles, terpene profiles, etc., you want to make sure that those profiles stay consistent. And so keeping it in like a mason jar, in a dark, cool place is ideal. And I'll just leave that there. The last one is, I talked about this already, but not passing judgment on the clients who are choosing to consume. I think this is a big deal, especially in this space, because of the stigma. People are fearful of talking about their cannabis consumption because of the demonization of cannabis in this space, and it has been going on for so long. And even though people are choosing to consume it, they still are stigmatizing themselves in their choice to consume. And so we want to create a warm, inviting environment, and that means to release all the judgment that we have to pass onto other people for the choice that they make. Sometimes I hear stories about, patients not getting consistent care, right? Like patient A looks a certain way. They don't look like they can pay. They don't look like they take care of themselves. And so we'll approach them in a way that makes them feel resistant to healthcare altogether. And, one of the things that I feel passionate about is being able to provide consistent customer service in the care that we're providing. And so we have to let some of these judgment, these stigma, the fear, the guilt, all that, we have to start letting that go. So that way, and here's the thing, and I didn't intend to talk about this piece, but as healthcare providers, I know that a lot of us have been victimized in our roles, and some of us are disconnected from our own bodies and the care that when we're offering care. So we probably don't always realize that we are projecting judgment and bias onto our patients. And I realize that a lot of healthcare providers have been victimized by the system, healthcare system. Burnout is real. Mental health conditions is real in healthcare providers and exponential in healthcare providers just because of the environment that we work on. But we have to work on being more mindful about the way that we deal with our patients, so that way our patients don't have to be also victimized because as a result of the system that we're working in. And so those are just a few of the guidelines that I want to walk through. There are 7 key principles that are embedded in there. When I go back to look at the comments, I'll make sure that I put the document from the National Council for State Boards of Nursing into the comment. I also want to invite you to reach out and just let me know if you have any additional questions. Again, I'm going to work on doing this once a week. 20, 30 minutes or so of just information about cannabis medicine, ways to implement cannabis into your practice, ways to shift healthcare perspectives. I talk all things spirituality. I talk things burnout, resilience, authorship, entrepreneurship. So if any of those topics, anything within the realm of those topics come up for you, feel free to ask me those questions and I'll bring them to the Facebook group. And hold on, let me go to the Facebook group now and see if there are any questions in here. And let me know if this was helpful for you, because I feel like there are a lot of questions that people have, and um, they're afraid to ask it or they don't know what to ask. And so part of my role, my responsibility in the work that I do is to help people find the questions for them. So if you just need to work through something, like you're feeling kind of foggy and you don't know what questions to ask, feel free to do that. But otherwise, I just want to let you all know that you should make time to breathe. um, get back into your body today. I'm in Maryland, so the weather has broken. So we have space to go outside and enjoy the sun. So definitely do that. But otherwise, I would like to encourage you to reach out. Let me know if you have any questions. Otherwise, I'm Ashley. I'm just a nurse who went to an HBCU and has worked my way up into a 6-figure position, and has been able to monetize my skills and expertise. And I want to be able to help other people do the same thing. So if you consider yourself to be a healer, I definitely think that you deserve to be here right now. So hope to hear from you soon. Talk to you soon. Bye.